8 early prostate cancer warning signs that men shouldn't ignore. Picture this. Right now, countless men are going about their daily lives unaware of a critical health concern developing within them. Prostate cancer affects 1 in 8 men, making it one of the most common cancers in men worldwide. But here's something that might surprise you. When caught early, the survival rate skyrockets to an incredible 98%. Yet many men brush off the early warning signs, thinking, "I'm too young or it won't happen to me." According to the American Cancer Society, over 288,000 new prostate cancer cases will be diagnosed this year. What's truly eye-opening is that this condition doesn't discriminate by age, lifestyle, or health status. While age plays a role, factors like family history, ethnicity, and even diet significantly impact your risk level. In the next few minutes, you'll discover 8 crucial warning signs that every man needs to know about. This isn't just another health video. It's potentially life-saving information that could make all the difference between early detection and a missed opportunity. 1. Frequent urination. Have you been making more trips to the bathroom lately? Let's talk about frequent urination. Not just the annoying kind from drinking too much coffee, but a pattern change that could mean something serious. Most people hit the bathroom every 3 to 4 hours during the day. But when prostate cancer starts developing, this routine can change dramatically. The real kicker shows up at night. You know how most people can sleep straight through without bathroom breaks? Well, when your prostate acts up, you might find yourself doing the midnight shuffle to the bathroom more often than usual. We call this nocturia, fancy medical term for getting up to pee at night. Normally, you should be able to sleep 6 to 8 hours without interruption. Here's why this happens. Your prostate sits right next to your bladder. When something's not right, like a tumor starting to grow, it puts pressure on your bladder. Think of it like someone slowly squeezing a water balloon. You'll feel the need to go more often, even when your bladder isn't really full. Pay attention if you're suddenly planning your day around bathroom locations, or if your peaceful nights have turned into bathroom marathons. 2. Painful ejaculation. Let's talk about something men often hesitate to discuss: painful ejaculation. Look, I know this isn't dinner table conversation, but understanding this symptom could save your life. When ejaculation starts causing pain, it's your body waving a red flag that deserves attention. This isn't your regular discomfort. Some guys experience sharp pains in their penis, while others feel a throbbing ache in their testicles, or even a deep, uncomfortable sensation in their lower abdomen or rectum. The intensity varies dramatically, from mild discomfort that comes and goes, to pain so intense it makes them avoid intimate moments altogether. Many men struggle silently with this symptom, hoping it'll just disappear on its own. Others feel too embarrassed to bring it up with anyone. But here's the reality: this kind of pain isn't normal, and it's not something you should just tough out. The duration of pain can be unpredictable, lasting mere seconds for some, while others experience prolonged discomfort. In either case, your body is sending you an important message that shouldn't be ignored. Number 3. Blood in urine. Seeing blood where it shouldn't be is scary stuff. When it shows up in your urine or semen, it's not something to shrug off. Doctors call it hematuria when it's in urine and hematospermia in semen. But fancy terms aside, let's get real about what this means. Picture your prostate like a neighborhood with tiny blood vessels running through it. When cancer starts growing, it can push against these delicate vessels, causing them to break. Sometimes the bleeding is so slight you barely notice it. Maybe just a pink tinge in the toilet bowl. Other times it might be more obvious, turning your urine a rusty color or leaving streaks in your semen. Look, I get it. Nobody wants to think about this stuff. And sure, sometimes blood can show up for less serious reasons like infections or inflammation. But here's the thing. Your body doesn't just randomly decide to start bleeding for fun. It's like your car's check engine light. You wouldn't ignore that, right? Even if it only happens once or twice, even if it goes away on its own, write it down. Remember when it happened. This kind of information could be crucial for catching something serious early on. Number 4. Pain while sitting. Ever notice how sitting through a long meeting becomes unbearable, but not because of the boring presentation? Pain while sitting isn't just about needing a better chair. When your prostate starts acting up, it can turn a simple activity like sitting into a real pain in the, well, you know where. The discomfort shows up in weird ways. Sometimes it's a dull ache that just won't quit. Other times, it feels like someone's jabbing you with tiny needles. Your lower back might start complaining too, and not in the usual, I need to stretch kind of way. This isn't your average back pain that goes away with a hot pack or some over-the-counter pills. The tricky part is how this pain sneaks up on you. At first, you might only notice it during long car rides or when you're stuck at your desk all day. But gradually, it becomes your unwanted companion, even during short sits. Your body's trying to tell you something important here. There's pressure building up where it shouldn't be. Think about how your daily routine changes when sitting becomes painful. Maybe you've started standing during meetings or can't enjoy your favorite shows on the couch anymore. 5. Bone pain. When cancer spreads, it's got a favorite destination: your bones. That nagging pain in your back, hips, or chest isn't always from hitting the gym too hard or sleeping wrong. Here's the deal. When prostate cancer cells break free, they're like unwanted tourists who love setting up camp in your bones. This isn't your typical muscle soreness that fades after a hot shower. We're talking about a deep-down ache that just won't quit, the kind that wakes you up at night and makes you wince when you move. Maybe it started in your lower back, then slowly crept into your hips. Or perhaps your chest feels tender in spots where you definitely didn't bump into anything. The really sneaky part? These aches can feel a lot like normal getting older pains or workout soreness. But there's a difference. This pain sticks around, playing hide and seek with your comfort levels. Some days it might ease up, fooling you into thinking it's nothing serious. Other days, it hits you like a freight train. Don't brush off persistent bone pain, especially if it keeps you up at night or shows up in multiple spots. 6. Swelling legs and feet. If your shoes suddenly feel tight or you notice your legs and feet swelling up, pay attention. This isn't about standing too long at work or eating too much salt. When prostate cancer advances, it messes with your body's drainage system, the lymph nodes. Think of lymph nodes like your body's filtration plants. They're supposed to keep fluids moving smoothly through your body, but when cancer cells crash the party, they can block these channels like a traffic jam. The result? Your legs and feet start looking like water balloons. The swelling usually sneaks up on you. Maybe you notice your socks leaving deeper marks than usual, or your favorite shoes don't slip on as easily anymore. Some guys first spot it when they can't see their ankle bones as clearly as before. This isn't the kind of swelling that goes away after propping your feet up for an hour. Here's what makes this tricky. Lots of things can make your legs swell. But when it keeps happening, especially if you're noticing other changes we've talked about, your body might be waving another red flag at you. 7. Weight loss. Dropping pounds without trying might sound like a dream, but let's get real. When you're losing weight without changing your diet or hitting the gym, something's up. Your body's telling you a story here, and you need to listen. Cancer cells are like tiny energy thieves. They raid your body's resources, burning through calories faster than a marathon runner. You might notice your clothes getting looser, your face looking thinner, and your appetite doing weird things. We're not talking about dropping a few pounds during a stressful week. This is steady, unexplained weight loss that keeps going. The exhaustion hits you too. Not your normal, need an extra coffee, tired, but a bone-deep fatigue that sleep can't fix. Maybe you're out of breath climbing stairs you used to take 2 at a time, or finding yourself needing naps when you've never been a nap person before. Your body's fighting a battle you might not even know about. Every pound lost isn't a victory. It's your body struggling to keep up with these cellular pirates stealing your energy. Number 8. Numbness and weakness. Let's talk about numbness and weakness, not the kind you get from sleeping on your arm wrong. When prostate cancer spreads to your spine, it's like someone messing with your body's wiring system. Your arms and legs might start feeling tingly, weak, or just plain numb. Think of your spine like a highway where all your nerve signals travel. When cancer puts pressure on this highway, messages from your brain start hitting roadblocks. You might fumble with buttons on your shirt, trip over nothing, or feel like your legs are moving through molasses. Some guys first notice it when they keep dropping things or can't grip their coffee mug like they used to. The really serious part? Sometimes this pressure can mess with your bathroom control. Yeah, we're talking about suddenly not being able to hold it or not knowing when you need to go. It's not just embarrassing, it's your body screaming for attention. This isn't like the temporary numbness from sitting weird or sleeping funny. These changes stick around, sometimes getting worse bit by bit. Your body's trying to tell you something seriously wrong with its communication system. Don't gamble with your life. These warning signs aren't just symptoms. They're your body's desperate signals. With a 98% survival rate for early detection, you can't afford to wait. Your family needs you. Your future needs you. Take action now, before these warning signs become a diagnosis you can't reverse. Thank you for watching. Don't forget to subscribe. See you on my next video.